HealthWise Alternatives with Jackie Bell, promoting good health through information and education.
Welcome to HealthWise Alternatives. I'm your host, Jackie Bell. The goal of HealthWise Alternatives is to bring you information about natural medicine. When we think of natural medicine, we usually think of herbal remedies, vitamins, nutrition, and different therapies such as massage and acupuncture. I hope that by watching this series, you are finding out that natural medicine is much more than that. Today we have a guest who has masterfully addressed one of the most influential aspects of our health and our ability to heal, the power of our mind over our body. Peggy Huddleston has authored a book called Prepare for Surgery, Heal Faster, a guide of mind-body techniques. Renowned for her research and development of a program that helps you heal faster, Peggy developed an effective 5-step technique to prepare for surgery. Scientific research shows that the Heal Faster technique significantly reduces anxiety before surgery. It lessens the use of pain medication by as much as 60% after surgery, and it helps people heal faster. Her program is offered at hospitals across the U.S., including Brigham and Women's Hospital, a Harvard Medical School teaching hospital here in Boston, NYU Medical Center in New York, and Kaiser Permanente Santa Clara Medical Center in California. Welcome, Peggy, and thank you for joining us on HealthWise
Thank you, Jackie.
Alternatives. So tell us a little bit about the background of your work, how you got started, the reason why you wrote your book, Heal Faster, and you've got it right here.
Yes, I wrote this book, Jackie, because I'm a psychotherapist. And I was living in Philadelphia, and I suddenly had a whole bunch of clients who were preparing for surgery. And they all were anxious in the same way. They were nervous about the anesthesia. They were worried about how much pain medication they were going to need after surgery. They were just very anxious, and they were having trouble sleeping. They came and said, what can I do? So I realized they needed help. So I developed 5 steps they could use in preparing for surgery. And that's how it all got launched, because of these clients. And as they used it, they said, this has helped me so much. I've gotten so calm. And my surgeon said I used much less anesthesia than normal during surgery, and I had less bleeding in the operating room and used less pain medication. Well, I thought I just had all the good patients. I had all the easy people, and I was just lucky. But they kept telling their friends about it. And they said, why don't you put this in a book? So that's when I took some time to write the book. And that's sort of the short story behind it.
And so this program that you've developed has actually been embraced by many hospitals across the United States and even in foreign countries. We have a film clip for you of a doctor in a hospital here in Boston. And Peggy, why don't you introduce this little film clip?
This is with Dr. Ben Bierbaum, who for years was chief of orthopedic surgery at the New England Baptist Hospital in Boston. They're famous for their orthopedic surgery. And he's famous for hip joint replacements. People come from all over the world to have him replace their hips. Remember the golfer Jack Nicklaus?
Yes.
He picked Dr. Bierbaum to replace his hip. And I did a research study with Dr. Bierbaum at the New England Baptist Hospital with patients using my program to prepare for knee joint replacement. And it showed that patients used significantly less pain medication and left the hospital sooner, as a result, saving the hospital about $3,000 per patient, and had a much happier patient. So this is a film clip of a patient about to have surgery at the New England Baptist Hospital, and you'll see him afterwards saying how it helped him, and then you'll see Dr. Bierbaum explaining why he recommends it to his patients.
Few experiences cause more fear and panic than being wheeled into the operating room for surgery. But what if there's a way to regain some of the control of what happens to you as you go under anesthesia? News Center 5's Liz Bruner has the story of a simple program that's not just calming patients' nerves, it's helping them heal faster.
Arnold Singer isn't dreading his upcoming surgery. He's preparing for it.
I think if I had nothing to do, I would be just wound up tight because I'd be focused on worrying about the operation, whereas this way I was focused on healing.
What Arnold's been focusing on is this.
Imagine the healing process that's going on until you can see and feel yourself completely recovered and healthy.
Psychotherapist Peggy Huddleston has written a book outlining 5 steps she believes not only calm preoperative nerves, but help to speed recovery.
When you get deeply relaxed, your body produces more T cells. Those create a stronger immune system, and then you heal faster.
First, she says, use relaxation techniques in the days prior to surgery and try to visualize yourself healed. Then she recommends organizing a support group.
I contacted about 30 of my best friends and relatives, and I asked them to think about me right now, right as we speak, just preceding the surgery, and to wrap me in a blanket of love.
Susie, you are wrapped in a soft, richly textured purple blanket of love.
It worked for Susie White. 4 months after having her hip replaced, she still wears a scarf her daughter made as a memento of her surgery.
I started out not being able to move my leg that was operated on, and within a few hours I could get it up and get myself out of bed.
She also did step 4, met her anesthesiologist before surgery to establish trust, and
following this operation,
you will feel comfortable and you feel very well.
Had him read healing statements before and after the operation.
So as their anesthesiologist says the statements to them, it's like hypnosis.
Dr. Ben Bierbaum recommends the program to his anxious patients. He can't fully explain why it works, but says his patients get tangible results.
They're much more relaxed. They take less pain medication. They seem to be out of the hospital at an earlier time. And the whole experience is a positive one.
This 5-step program is being offered at New England Baptist Hospital and is also working its way into other area medical centers like Brigham and Women's and the Leahy Clinic. If you'd like more information on the program, you can log on to our website, thebostonchannel.com. On the Health Beat, I'm Liz Bruner.
Peggy, would you please describe the 5 steps in your technique and how it actually helps people reduce anxiety?
Yes, and if there's someone watching now who says having surgery in 2 days, I'll explain it so that it can help them with only 2 days notice, or someone who has 2 weeks before surgery.
Okay.
So that your whole audience can be helped by this. Or if someone just has plain anxiety, how it can be used to reduce just plain old stress. Step 1 is they listen to a relaxation CD, which I have here, and they get deeply relaxed. It's only 20 minutes, but as they listen to it and get deeply relaxed, they go from feeling very anxious to feeling peaceful. People who have insomnia often say they fall asleep listening to it. And a study at the New England Baptist Hospital in Boston, a Harvard teaching hospital, documented that listening to this reduced anxiety and used to pain medication. So that's step 1, is getting relaxed. Step 2 is a person turning their worries into positive end results. So say for a knee joint replacement, they would, whenever worries popped up, instead of worrying, they'd make a choice to imagine they're doing what they love to do. They might imagine they're on the tennis court playing tennis and their knee feels really strong and marvelous. It's healed and it's fine. In other words, they learn to have the feeling that everything is healed rather than the worry that it won't heal.
Okay.
And then step 3 is my favorite one, Jackie. They ask their friends and family for the whole half hour before surgery to think of them wherever they are. They could be at home or at work. And the patient's in the holding area waiting for surgery. And the friends think of them and wrap them in a blanket of love. It's the color that feels comforting to this person. And if they get about 10 or 20 friends to do that, the person will just feel love wrapping around them. So they feel calmer and peaceful, and they'll need less anesthesia when they go under the anesthesia because they're now very calm.
And so these people don't have to be with them in this holding area. They can be
at home,
anywhere, at home
on the golf course, anywhere, just thinking of them. And the person will feel it. And people say, well, how's that possible? That you can be at a distance, you could be 1,000 miles away.
Right.
And people who are in love with someone who's not right beside them, they often will say, I can feel his love around me. They can feel when someone's loving them. And the reason we can feel this is because there are 2 levels going on. One is we're in a physical dimension where right now we're 3 feet apart, but also we're spiritual beings. Where at a spiritual level, we're actually all one.
Right.
And in that level of oneness, there's no distance. So when you shift into feeling love for someone, you shift into your spiritual dimension, and in that place there is no distance. And so a person can be anywhere in the world feeling their love for another person, and that person will feel it. So that's the reason it works. And a person doesn't have to believe that, because they could be an atheist and say, I don't believe that stuff.
Yeah.
But all they can do is think of someone they love and just feel their love for them and just wait for the phone to ring. Because they'll usually call and say, I was just thinking of you.
Yeah.
And the person will call. So that's step 3.
And that's the half hour, actually.
That's the
right
half
before
hour,
surgery.
right before surgery. And the 4th step, there's actually a page in the book of healing statements. And the patient will Scotch tape, I'm just looking for it now, the person will Scotch tape this page to their hospital gown of these healing statements. They'll cut it out of the book and Scotch tape it to their gown. And they'll ask the anesthesiologist to say, or a nurse in the operating room, to say the first statement as they go under the anesthesia, and it'll cause them to use, the research shows, anywhere from 23 to 50% less pain medication following surgery.
Now, is that a statement that they've written themselves, or is it one in the book?
It's in the book. It says, following this operation, you will feel comfortable and you will heal very well. And it's repeated 5 times. So as they're going under the anesthesia, they're going to deeper and deeper altered states of consciousness. This is put into their unconsciousness, these deep altered states. So they actually wind up using less pain medication. And then the second statement they say towards the end of surgery, your operation has gone very well, 5 times. They could have said it 4 times or 6. I just picked 5. And then this one, the third one, can reduce nausea down to usually 0, almost 0, or eliminate it. It'd say, following this operation, you will be hungry for. And the patient fills in here the name of their favorite light liquid, like chicken soup or ginger ale. And so they'll wake up in the recovery room saying, I'm really hungry for chicken soup. And the nurses at the hospital say, honey, we don't serve that in the recovery room. But if you're hungry, you have no nausea. You can't be nauseated and hungry at the same time.
And so that's during the...
They'll say that towards the end of surgery. Following this operation, you'll be hungry for chicken soup. You'll be thirsty and you'll urinate easily. So then their bladder wakes up fast and their stomach, because their stomach's saying, ooh, where's the chicken soup? I want to get ready for it. So at the Brigham and Women's Hospital, where they recommend my program to patients, and they give a free 1-hour Prepare for Surgery Heal Faster workshop by phone to any patient using this program, they find that patients normally leave the recovery room 1 to 3 hours sooner because they have a faster return of bladder and bowel function and a faster return improvement in their vital signs. So they have a happier patient who's doing much better.
Amazing. And the 5th step?
The 5th step is having good doctor-patient relationships. At the Brigham, they can just say, I'm using this program, and the anesthesiologist will say, I'm glad to say the healing statements. At another hospital that may not use it, it shows the patient how to advocate, to ask for it. Okay. So the nurse will say, I'll be glad to say these statements for you.
Now, why is the anesthesiologist or a nurse the important one to ask to say these statements during surgery as opposed to the doctor?
Well, the surgeon's busy doing the operation, so you want to keep him or her, let them focus on you. And sometimes the anesthesiologist can say them, sometimes a nurse who's circulating in the OR can say them, so it could be anybody.
And this is unusual. It's in your book, I think, that to actually develop a relationship, professional relationship with the anesthesiologist before the surgery, maybe a week before, or call them the day before and just talk to them on the phone, hear their voice. And what's the importance of that? Well,
they only need to do that in hospitals that don't use my program. It's really to advocate, to ask the anesthesiologist, will you do this? So that they don't have the uncertainty of getting to the hospital and the anesthesiologist says, I'm not going to say those healing statements.
Okay.
That's the only reason. So at a hospital like Brigham and Women's, they know the patient can relax knowing the statements will be said, and there's a level of comfort. But research has shown that in just a 5-minute visit of an anesthesiologist with the patient, that actually reduce the use of pain medication. So just having a short 5-minute rapport developed more of a relationship. But it's actually hard to do because you usually only meet the anesthesiologist the night before surgery. I mean, sorry, not the night before, the way you used to, say 20 years ago, but you meet them 20 minutes before surgery. Oh. So when I actually do a new edition of the book, I will change that because it's become impractical for hospitals to do it. I wish it were practical, but it just isn't.
Okay. And I know that there's research studies behind your work. Could you describe a few of those studies and the benefits of using the book and the relaxation and what the research found?
There was a research study that was done at New England, the New England Baptist Hospital. I mentioned their study was knee joint replacement. But there's another study done at Beth Israel Deaconess Medical Center in Boston. They gave patients my relaxation tape. It was in a tape before it was a CD. And these were patients who were hospitalized and not having surgery. And they just asked them to listen to it for 20 minutes twice a day. And they found that patients using it for 20 minutes twice a day had less anxiety, used less pain medication, and had an improvement in heart rate variability. And 100% of the patients said they would recommend giving it to every hospitalized patient. And it's published in the in a wonderful journal, the Journal of Alternative and Complementary Medicine, in March of 2007. There's another study that was very interesting findings at the Leahy Clinic in Burlington, Massachusetts. This was the patients having colorectal surgery. And they gave them a 1-hour workshop by telephone. They gave them the book and the CD, and they found patients who were randomized to use the program. By the day 2 at home, we were using 60% less pain medication than the control group. And they also left the hospital 1.6 days sooner than the control group, which saved the hospital $3,200 per patient. And if they only had 315 patients do that, they'd save $1 million in 1 year. Wow. So it's a huge cost savings for the hospital, and they had a much happier patients.
Much happier patient, yeah.
Do you know what your audience might find interesting? Because I know your program really focuses on alternative healing methods and options of things people can do. What I've learned, and it's been a surprise and such a learning, some people have used my program to prepare for surgery and so reduced their anxiety preparing for surgery that the area that was going to have the operation actually healed. And they found out a few days before surgery they didn't need surgery. And I didn't know this was possible until people would call me up and explain that it happened. I'd say, it did? And so I'm now collecting these case studies with the medical notes from the surgeon describing the case before, the test documenting what was happening, and the documentation of the healing. I'll give you an example. There's a woman who had broken her right leg skiing, and a year later, the bone still hadn't grown back enough, and they're going to take out the hardware, put in new hardware, and they had just done an x-ray, and they found there's so little bone growth in her right leg that they were going to have to do a bone graft from her hip to her leg. This is at Beth Israel Deaconess Medical Center. And she came to me about 3 weeks before surgery to have me guide her through a 1-hour workshop using the book and CD. And in that workshop, I said, well, can I show you how to talk to your leg? And she said, well, yeah. So she was all relaxed, and as she talked to her leg, I said, ask it, what is it feeling? And she sort of closed her eyes and said, oh, it's scared. So well, I said, ask it why? I said, oh, it's just so apprehensive about what's going to happen. Metal's going to be taken out, new metal's going to be put in, there's going to be bone put in. So well, ask it, what comforting emotion would it like you to give it? So she closed her eyes and she said, it wants love. How do I do that? And I said, well, ask it. And so just put your hands on me and let love flow in. So she put her hands on her leg, and almost the way you'd stroke a baby, and she ran them down her leg like this. And you could feel love coming out of her hands. I said, do you feel that? She said, yes. And I said, ask your leg, how many times a day would it like that feeling? She said, oh, it wants it for about 5 minutes, 3 or 4 times a day. She said, oh, it feels so good. So she called me up 3 weeks later after surgery and said, Peggy, when they opened up my leg, so much bone had regenerated in 3 weeks that they canceled the bone graft for my hip.
Wow.
So that was such a tangible example, because she had had a whole year of healing, and the x-ray that was done just a few days before I saw her had shown evidence of very little bone growth.
It's amazing.
So the power of our thoughts, which is what your show is all about,
right, yeah,
is I've been just learned so much about the power of our thoughts for self-healing. We're so incredibly powerful. And what your show is doing is helping people believe it's possible, because you give them examples. That's what people need. They need examples of how to do it, that someone else has done it, that here's the documentation, here's where you can read about it. And for those who feel, I want to try that, I believe it's possible, it's the belief. As they begin to use it, they'll get the results. So that's what I've learned. And it's just been the growing edge of what I'm discovering of our ability to heal is so extraordinary. And it's usually our emotions that are getting in the way causing the problem, because it blocks flows of energy in the body.
Right.
And it's, as you know, with your work with thermography.
Right. With when we look at chronic disease, we know that underlying factors of chronic disease are usually threefold. One would be some kind of virus, bacteria, fungus. The other would be some kind of toxin or poison, whether it's a chemical or heavy metals or something like that. And the third, which is usually the strongest and binds everything together, is the psycho-emotional trauma of some sort, or some kind of negative psycho-emotional belief. And it's when people get to that place of letting that go, working it through, and there's all kind of remedies for that, homeopathic, flower essences, and just actually feeling so much better as you start to detoxify and restore your body's health, nutritionally, etc., that you shed those negative emotions and feelings. You're ready to forgive, you're ready to let go. Do you see it being used on the prevention end as well? You know, people want to lose weight, and people who, might be suffering with a chronic disease like diabetes or, asthma, something like that. Can it be used for that?
Well, for example, when I did my graduate study at Harvard Divinity School, I worked with people who had just been diagnosed with multiple sclerosis. And I showed them what they could do to start a remission. So a remission just wasn't something that happened to them if they were lucky. I could show them what they could do by getting deeply relaxed that would put the disease process back into remission. And those people I've followed for 20 years. And they now, if they have a flare-up, they know what they need to do to put it into remission. So it gives them a feeling of control rather than the disease controlling them. So it definitely can be used in that. I've not used it with people with diabetes. So that's not an area I can speak on, but I've used it with other chronic conditions that are stress-related. And they say 85% of illnesses are stress-related. So you just show someone how to shift themselves from having their sympathetic nervous system be the dominant one, where they've got the flight or fight response zooming along, to the deep one of peace, and everything gets better. It's been remarkable to see. I've seen it work very well with post-traumatic stress syndrome.
Really?
So that's where it's going. But this is because I've learned from people doing it. So I'm learning things that I didn't know were possible.
Where else is it being used?
It's all over the country in hospitals. And the book's just being translated now into Spanish and also Arabic. So I've been asked to train some staff at hospitals in the Middle East. So it's getting a wider and wider use in more languages.
And so that must, do you find yourself lecturing in these foreign countries as well?
I do. I did grand rounds at the largest hospital in the Middle East in Riyadh in Saudi Arabia. And
it was well received?
They were in fact, it was easier lecturing there at a group of doctors than at a Harvard Medical School teaching hospital. Because in that country, being an Islamic country where they pray 5 times a day, they're needing a way to bridge their rich prayer life with modern medicine. And their hospitals have all the shiniest Western medical equipment, but they need a bridge from their prayer to bridge to the medical equipment. And they saw this technology of mind-body technique explaining why prayer is so powerful. So it was actually easier talking to them because they're coming at it from a different direction.
Yeah.
In mainstream medicine, I have to present the research of mind-body techniques. I have to go from the biomedical model to the power of prayer.
Right.
Whereas they said, we already know the power of prayer.
Right.
It was fascinating working with them. And a woman came up to me after I presented at grand rounds at that hospital. It was King Fahd Medical City in Riyadh. And she said, my little boy, when he was 2 years old, had been in an accident and his liver was lanced. And the doctor said, we're not even going to treat him because we know nothing will work. She said, I sat at his bedside. It gives me chills as I say it. She said, I sat at his bedside and prayed all night, and my husband did too, and he's a doctor here at this hospital so they can document it. And by morning, he was fine. And they said it's a miracle because they said we had given up and we did no treatment. But she prayed unceasingly all night long, as did her husband. And she was just so alive with the miracle that she had witnessed. And what's interesting here in the American hospitals is documenting that scientifically.
Right.
So that's what I find is a spectrum that I like to work on, is the documentation to prove the power of belief for healing.
And proving the power of love.
And the power of love, most of all.
Well, Peggy, thank you so much for being on our show. Your work is really fascinating, and I'll be definitely keeping up with you and looking forward to your next book and following your lectures. And we're just really happy that you have been given the gift to show us how to heal faster before and after surgery.
Thank you, Jackie.
Thank you for joining us on HealthWise Alternatives. It's been our pleasure to bring you information about natural health. I'm Jackie Bell. See you next time. This season on HealthWise Alternatives, we will be interviewing holistic medical doctors, practitioners, and counselors who will explain natural medicine approaches to health and disease. HealthWise Alternatives is created by The Woman in You and Take One Films. Check our website, thewomaninu.info, for scheduling information or contact your local cable access.